Child abuse, philosopher Ian Hacking has said, is the worst of private evils. Society feels compelled to act to prevent the abuse of children, particularly in light of gut-wrenching stories of horrific harm to the innocent. But how to act and what are the unintended consequences of our actions are questions that are far less clear. In fact, there's an astounding dearth of data about the extent of the problem and what is an effective way to address it. Okay. Child abuse has a broad definition which differs in state and federal statutes. Rates of child abuse are dependent on reporting, which is subject to considerable bias. There is very little evidence to support most of the interventions designed to prevent child abuse. That's kind of shocking, isn't it? Furthermore, responses to child abuse allegations are clearly racialized, with black families being overrepresented at every step of the way within the child welfare system. Data from the past decades indicates that black families are disproportionately referred to protective services for concern for abuse. These allegations of abuse are more likely to be substantiated. Black children are disproportionately removed from their homes, and they spend longer time in substitute care. So you're probably asking yourself at this point, why is a title making child abuse white? So I hope I'll be able to tie this all together. Is this you? Is that? Yeah. In this talk, I examine the historic roots of our current child abuse policies. In the early 1960s and 1970s, social scientists amassed data indicating higher rates of child abuse amongst low-income and African-American populations. This data was imperfect, of course, and reflected biases in screening and reporting, problems evident to this day. Nonetheless, researchers used these findings to argue that poverty and racial discrimination were causal factors in child abuse, and that social ills must be addressed to help protect children. Yet, despite this evidence, policymakers continue to portray child abuse as a, quote, colorblind, class-free problem. This was done ostensibly to garner bipartisan support for child abuse prevention interventions, and also to avoid further stigmatization of already marginalized populations. Yet these arguments led to the creation of well-intentioned policies that have had unintended consequences, the focus of this talk. The story I'm telling today is an attempt to reconcile how 1970s policymakers adopted a view of child abuse as being class-free and colorblind, and particularly rooted in individual mental health, and at the same time developed policies that disproportionately impacted families of color. Let me take a few steps back now and offer a brief overview of the history of child abuse in the United States, and then introduce a group I focus on my research, which is Parents Anonymous. Historians have typically pointed to a number of pivotal moments in the development of the concept of child abuse. Children have been hurt physically, emotionally, and sexually in their homes throughout history. But child abuse is a relatively new term. In the late 1900s and early 20th century, this was described as a form of cruelty to children. Jumping forward in the world's quickest history of child abuse, the 1960s saw the rise of a medical category, the battered child, based on seminal publications by pediatrician Henry Kempe in 1962. Numerous factors contributed to the rise of the battered and later abused child. Radiographic studies that indicated broken bones that otherwise would have remained hidden. Professional prestige of the pediatricians who described this syndrome. Media zeal in describing horrific stories of child abuse, rallying the public to support action. And finally, child abuse policies reflected the somewhat naive prevailing approach in the 1960s, which believed that government agencies could work together to ameliorate society's ills. Sounds a little quaint today, right? Child abuse quickly became a top concern for the lay public as well as for politicians. By 1967, all 50 states had passed some form of mandatory reporting law, requiring physicians and other professionals, particularly nurses, to report suspicions of child abuse. By the early 1970s, child abuse had become a rallying cry for politicians, educators, and child advocates. At that time, The prevailing belief, shared by physicians, child welfare experts, and the lay public, was that child abusers were sick, mentally disturbed, and in need of treatment. At the time, there were a number of articles published in both academic journals and in the popular press that were talking about how we can cure child abusers and what is the individual psychopathology that leads people to abuse children. Invariably, these focused on the parents' own unhappy childhood, their own history of having been abused themselves, and their low self-esteem, which was a buzzword that was very popular in the 1960s. So these are treatment for child abusers, a psychological review, understanding child abusers. This is in the Chicago Tribune. According to one psychiatric social worker, abusers are hurting. They're feeling people who really love their children, but they hate themselves. And the next paragraph, for many parents, child abuse amounts to a retroactive abortion. So kind of shocking psychological terms to describe really a shocking phenomenon. Now let me introduce Parents Anonymous. Parents Anonymous was a self-help group founded in 1969 by a young California woman known as Jolly K and her psychiatric social worker, Leonard Lieber. Jolly K, a colorful character who would later reveal that she had worked as a Hollywood prostitute, sought support to address her self-described abuse of her daughter. Modeled after common self-help groups of the time, like Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, it was designed to give support to parents who had abused or were concerned that they might abuse their children. Initially a small local group, Parents Anonymous positioned itself as an important player in the field of child abuse policy. In an era when the media was particularly interested in the human face of child abuse, Parents Anonymous definitely lent itself well to media coverage and actively sought to spread the word of their organization. A 1973 profile in Women's Day, at last, Help for Child Abusers, attracted much attention to the work done by Jolly, Lieber, and others. In the early 1970s, Minnesota Democrat Senator Walter Mondale, working with colleagues, developed legislation to authorize funds for child abuse prevention and treatment. This would become the Child Abuse Prevention and Treatment Act, which is still in force today. This is called, I'm going to refer to the CAPTA, that's how it's referred to. It was signed by President Nixon in early 1974 and has enjoyed decades of bipartisan support. So I'm going to take a step back now and talk a little bit about how Mondale approached this legislation and particularly why. In 1971, Mondale had put forth a major piece of legislation, the Comprehensive Child Development Act, that would have ensured universal child care for every child in the United States. It was subject to extensive controversy, not all of which was partisan, but it ultimately passed both chambers. Yet, it was vetoed by Nixon, citing, I'm going to quote now, family weakening implications, end of quote, of universal child care. There was a big editorial in the newspaper that said, Mondale wants to Sovietize American children by sending them all to camps. Heaven forbid we have daycare for our children in the United States. In contrast, the CAPTA, also designed to improve the well-being of Americans' children, was warmly embraced by the Hill. So what explains that difference? One of the reasons for CAPTA's success was it intentionally circumvented discussions of race and class. The bill essentially was designed to make it impossible for Nixon, a veto-prone president, to veto it. While research in the 1960s and early 70s had found that child abuse was more common in low-income families, Mondale actively pushed an agenda presenting child abuse as a scourge of all walks of society. It was abundantly evident in the 1973 hearings. For instance, researcher David Gill, a pathbreaker in the field of child abuse research, testified on the higher incidence of child abuse in poor and minority families. Gill argued that the increased incidence of child abuse in lower income families could not be attributed simply to over-detection. Mondale pushed back, asking pointedly, I quote, "Would you yield there? Would you not say that the incidence of child abuse is found as well in the families of middle-class parents?" End of quote. So as you can hear, this is really an odd use of the term incidence, which, as anyone who's taken a stats class knows, this is not something you either have or don't have. Yes, you have child abuse throughout the different socioeconomic status, but you will have more of it where there's higher incidence. But it also demonstrates Mondale's commitment to presenting child abuse as an equal opportunity social ill. Gill conceded, of course, yes, of course child abuse happens in middle-class families. It's just a question of how frequently it does. To this, Mondale quickly added, and I'm going to quote, "This is not a poverty problem, this is a national problem," end of quote, making his agenda clear. Parents Anonymous fit easily into this agenda. Touted as the most powerful testimony given at the CAPTA hearings, Jolly Kay was young, articulate, and easy to identify with. She was also unmistakably white. Her narrative was compelling, a sinner who had repented. She and the other abusers were monsters who had hurt their children. She cited her own experiences as an abused child and added that the daughter that she had abused reflected her negative self. Mondale asked, "Wait, is this what the psychologists call when you, quote, hate something you sense in yourself?" End of quote. Jolly agreed. It was the body of the child, but it was your own identity you were hurting. She asked pointedly, "Was hurting your child homicide or extended suicide?" End of quote. This pop psychology framework resonated with the popular discourse of the time. While there were some dissenters who warned against the medicalization and psychologization of child abuse, they were the minority. It was just simpler to believe that only seriously disturbed people could do something as seriously disturbing as abusing their children. Interventions to improve the emotional health of parents were seen as key in preventing child abuse. With the passage of CAPTA, funds were made available to support child abuse interventions. With Mondale's support, Parents Anonymous applied for newly available federal grant funding, which they received. And this is a letter I have in the archives in which Jolly Kay and Mondale correspond. And Mondale says, "I wrote to the Office of Child Development expressing my strong support for your letter." I have that letter too. So they didn't just apply for funding. Mondale helped them procure the funding by strongly supporting their application. So in 1974, Parents Anonymous budget goes from thousands to hundreds of thousands. At the time, it had 60 loosely knit chapters, mostly in California, and the main headquarters were located in Jolly Kay's kitchen. The grant was to support the utilization of parental self-help groups, and within a few years, hundreds of chapters had popped up in states throughout the nation. At the core, Parents Anonymous worked as a hotline manned by volunteers and a support group that met weekly. Other activities varied between chapters. As you can imagine, this structure does not require a lot of money for its day-to-day activities, and most of the funding went to promotion of the group and building new chapters. A significant amount of time of the members was not working with children or their families, but rather securing grants, going to the media, and doing public awareness campaigns to illustrate how important their work on child abuse was. So they were doing a lot more of awareness rather than treatment. While Parents Anonymous presented their mission as child abuse prevention, in reality, they offered more of a support group for parents, mostly mothers. Parents Anonymous also played an important role in redefining what child abuse was perceived as and what counts as child abuse. In order to join Parents Anonymous group, one had to either identify as abusing their child or be concerned that they may do so. And it's kind of weird. I mean, as a parent, I can't really understand this completely, but people were so eager to define themselves as child abusers, even though they had never laid a hand on their child. And by broadly defining what abuse meant, they could reach out to a large group of mainly white, educated women. And in a survey I looked at, some researchers found out, I quote, people wrote that they did not actually know they had a child abuse problem until they heard or read about Parents Anonymous, end of quote. So really broadened the definition of child abuse and enabled lots of people to identify with that. Parenting, self-esteem, and feelings of self-worth seemed to be the focus of the interventions. A highly psychologized language was used both in the media and by the individual members of Parents Anonymous to describe their work. So in 1976, for instance, one mom writes to Senator Mondale describing how the meetings helped her, quote, grow a great deal, end of quote, and that her, quote, abusive tendencies had diminished. Another woman, who later became a Parents Anonymous coordinator in Maryland, described how she had just received the third call of the day asking for money. Her utilities had been disconnected, and then her little boy asked her for something she had no money. She slapped him. After she joined Parents Anonymous, she became, I quote, more confident, more self-assertive, and not as insecure, end of quote. She doesn't make any further comments about her economic circumstances. The media readily adopted this narrative of Parents Anonymous as a treatment for psychologically vulnerable parents. Positive profiles appeared in the media throughout the nation, including a major newspaper. This is the New York Times in 1971. In that year, they still called it Mothers Anonymous. It later became Parents Anonymous. This is in Life, the big expose in which he talked about all the sordid details of her background, including an abortion and being raped, and like really a very revealing interview. You saw the Woman's Day cover I showed you earlier, and then we also have syndicated columns. This is a Dear Ann Landers in West Virginia that says, you know, I was an abusive parent, I joined Parents Anonymous, it helped me love and understand myself, and it may have saved my child. So what did Parents Anonymous actually do? They offered support to members, they manned a hotline, and in particular, they worked with the media to crystallize a perception of what child abuse was and what abusers looked like. And they were all American, or more aptly, white and middle class. Child abuse was everywhere, not just physical abuse or neglect, sexual abuse, emotional abuse, verbal abuse, and even emotional unavailability. In a survey of Parents Anonymous participants, the #1 concern for parents, by a significant margin, was verbal abuse. And this was also the form of abuse that occurred most in their homes. So the top chart, they say, we recognize 6 forms of child abuse. Which one is the biggest concern for you? And by a huge margin, they say verbal abuse. And then what do you think happens the most in your house? Again, 61 respondents say verbal abuse. Only 9 say physical abuse. While Parents Anonymous was promoting a perception of child abuse as omnipresent and as a call for help by abusers, policymakers were working to bring child abuse to the attention of local authorities. In the early 1970s, states adopted hotlines for reporting child abuse and encouraged reporting of any suspicion. While state agencies were expected to respond with the provision of services, all too often, children were removed from homes that were deemed neglectful, often a euphemism for poverty. For many children, the response to a report of suspected abuse was far more damaging than the abuse itself. The increase in out-of-home placement was drastic. In 1969, 226,000 children were in foster care. 3 years later, in 1972, the number was 320,000. And by 1977, the number had reached over 500,000. An additional 1.2 children were receiving services in their homes, bringing the number of families who were under the attention of social services to 1.7 million. While not all children in foster care were removed involuntarily, many were. And other families were threatened that if they did not voluntarily agree to relinquish their children, they would face legal sanctions, which is kind of the same thing as involuntarily removing them. Furthermore, a disproportionate number of children removed from their families were racial and ethnic minorities. For Native Americans, the statistics were particularly horrifying. Nationwide, between 25 and 35% of Native American children in all were in foster care. And just to illustrate in a few key states, in Minnesota, nearly one in every 4 Native American child born was adopted. In Montana, the ratio of Native American foster care placement was 13 times greater than non-Native American children. In South Dakota, 40% of all adoptions made by the state's Department of Public Welfare were of Native American children, although they only amounted to 7% of the population. This is clearly drastically disproportionate. The destruction of Native American families caught the attention of idealistic lawyers and activists who identified a crisis that was decimating the Native American community. In 1978, Congress passed the Indian Child Welfare Act, which offered protections to Native American children and empowered tribes with jurisdiction over child removal cases. Yet, while this crisis was unfolding amongst the Native American tribes, a similar crisis was occurring amongst African American families, particularly in large cities. Yet this crisis did not attract the same public attention and policy response. So I'm going to move away from discussing Native American families who were offered some respite with the 1978 Act and now turn to African American families. Black families were clearly hit hard with new child abuse policies and priorities. By 1977, 135,000 children in out-of-home care were African American, which is a little bit over a quarter of all children placed outside of their home. This was clearly a disproportionate representation of African American families, who amounted to approximately 11% of the US population at that time. Furthermore, data from 1977, which is actually consistent to this day, indicates that African American children placed out of their homes spend twice as long in substitute care, with a median of 48 months, in comparison to a median of 24 months amongst white and Hispanic families. Some of the increase in removal of children from their homes can be attributed to two significant policy changes of the 1970s. The first was a massive expansion of mandatory reporting policies, and the second was a transformation of child welfare agencies from a focus on service to a focus on investigation. In the 1970s, mandatory reporting rules gradually became more comprehensive, requiring more individuals to report a broader array of scenarios, which could be considered suspicious. CAPTA, the Federal Child Abuse Act, set certain reporting standards, which were criteria for funding eligibility. So if your criteria weren't strict enough, you wouldn't meet criteria for CAPTA and you couldn't get federal money. Furthermore, states set up hotlines and developed public service announcements to encourage individuals to report. So, for instance, I'm going to talk a little bit about Florida. Florida developed its first child abuse reporting hotline in 1971. The year prior, which is 1970, the state had received less than 20 reports of child abuse. So I'm not going to say that 20 reports of child abuse is the right number. I'm not sure what the right number is, but I'm going to say that 20 is probably not the right number. It's probably too low. But over the next 2-year period, the number was nearly 50,000. Of these, a majority of the reports focused on manifestations of poverty. Specifically, I'm going to quote now, malnutrition, physical neglect, disorganized family life, alcoholism, abandonment, and lack of food, clothing, or shelter, end of quote. These were all the focus of concern rather than physical or sexual abuse. So while all of these situations can endanger children, and I'm not saying that they're good, and probably they require intervention, there is a distinct difference between a poor child being hungry because lack of food and physical abuse. Yet the public service announcements on the radio deliberately lumped all these forms of abuse and neglect together. And there was a major campaign in Florida that focused on the question, who would hurt a little child? The answer was, you'd be surprised. One ad stated that in the previous year in Florida, over 19,000 Florida children were beaten, burned, neglected, sexually assaulted, tortured, and murdered, mostly by their parents. Okay, so this is technically accurate because they put the word neglect in there. So, if 18,000 cases were neglect and then 1,000 were all these terrible things they said, yes, you can still make that claim. But it grossly overemphasized the prevalence of significant physical abuse. And this is another one. Who would beat a little child? Thousands of people throughout Florida did. They beat them, starved them, tortured them, raped them, neglected them, and even murdered them. Their parents are sick, and you can help. And that was really the pull with these announcements. If you would call and report, the families would get help, and you were doing something good. But in reality, most reports were about the manifestations of poverty, and they led to intrusive interventions and removal of children from their homes. So if you report a child that they were poor and didn't have enough food, Okay, this is probably not going to come as a surprise to you, but it's not that someone came to their house and brought buckets of food and then they were all set. That wasn't the response or the service they would get. So they would have interventions and they would have investigations, and children were removed from their homes. They were subjected to institutional care. They were placed in foster care far away from their communities. And the truth is, children often suffered abuse in foster care and abuse in institutions. So maybe at home, their home was disorganized, as one of the quotes were, or maybe they didn't have enough food, but they had loving parents who were doing their best. They were placed in institutions and foster care, and a whole host of things happened to them. But the negative impact of child removal remained, and honestly, it still remains, largely invisible, while the risk of the child in their own home was greatly inflated. And I'm happy to talk about that more in the Q&A, but there's a lot of skewed incentives here, because if you make the decision to leave a child in their home and something terrible happens to them, you, the social worker or the caseworker, your face is going to be plastered all over the news. You're probably going to lose their job, and honestly, you went to caseworker because you love kids and you want to help them. You don't want anything bad to happen to these kids. But if you remove the child from their home and send them to a foster care or institutional care, there is really no accountability for removal that was unnecessary, or for the abuse that happens for unnecessary removal. So it's no wonder that you feel a huge pressure as a caseworker with a big caseload to remove more, because the incentives push you that way. Poor minority families soon realized that their family integrity was in danger. But poor minority families who had their children removed were and remain a difficult constituency to mobilize and empower. And the public has limited sympathy for those accused of abusing their children, regardless of their circumstances. A few groups of professionals began to advocate for minority families. For instance, here in New York, a short-lived group of child welfare and legal professionals created the New York Coalition for Families. They argue that New York, I'm going to quote now, like many states, uses foster care as its primary form of child welfare service to support as its primary form of child welfare service for poor Black and Hispanic families, end of quote. Minority families were not offered, quote, the supportive services they need to keep their families together, end of quote. Furthermore, while placement in foster care was not cost effective in itself to the state, because foster care costs a lot of money, the agencies who placed children had skewed financial incentives, because the money followed the child. So there was money for foster care. There was not money for services. So there was a huge financial incentive to place more children in foster care, because that was the way the money flew. In New York alone, according to the mayor's task force on child abuse, which Fontana, who some of you heard about yesterday, was the chair of, in the span of less than a decade, $300 million were spent on out-of-home care for children. And this is foster care and institutions. In contrast, only $3 million were spent on in-home services that could help keep families intact. This approach to child protection was not supported by the existing evidence. Okay, this is a really bad idea. This is not a good use of money, but it is a question of whose money and how is it coming from. So there were, again, skewed incentives to spend these kind of monies. Major child welfare researchers across the political spectrum repeatedly argued throughout the 1970s that child abuse definitions were too broad and too vague and subject to individual bias and interpretation. So when I'm saying across the spectrum, I'm including scholars at the Conservative American Enterprise Institute, as well as self-identified radical social workers. And they all agreed on this. Numerous scholars found that African American families were more likely to be brought to the attention of authorities for suspected child abuse, and repeatedly argued that many child welfare interventions are punitive rather than supportive. By the late 1970s, researchers nearly unanimously agreed that poverty and racial discrimination were a significant component and cause of child abuse in America, and suggested that interventions should be targeted at the community level to address this. To illustrate, this was the main takeaway point of a major child abuse conference in 1979, which was at University of Pennsylvania, jointly organized with Yale. And essentially all the top researchers throughout the nation came together, and their recommendations were work at the community level to address racism, racial discrimination, and employment inequalities and poverty, and this is the way to prevent child abuse. But As the voices of the expert grew louder and clearer, and they amassed compelling data that they shared with policymakers, child welfare politics were actually headed in a different direction. The Carter administration had limited energy to devote to what was perceived as an anti-poverty intervention. And by the early Reagan years, essentially social welfare interventions were all being cut back and defunded. So where did this leave us? In the 1970s, we had a strong advocacy for child abuse awareness, encouraging parents to seek help and address the mental issues that led them to abuse their children. Meanwhile, contemporary data showed that the majority of children coming to the attention of child welfare services were not, in fact, being physically abused, but rather suffering from poverty and its sequelae. Furthermore, researchers highlighted how poverty, isolation, racial discrimination, joblessness, inadequate housing, and additional social aids, for example, not having a telephone in your house, was a risk factor for child abuse because you were so isolated. How all these social factors created the conditions for the abuse of children, and it argued that these should be addressed as a form of primary prevention. Yet, most policymakers continued to favor this classless, colorblind approach to child abuse. This assumption shaped funding priorities, focusing on therapy for parents rather than alleviation of stressors and on raising public awareness. Of course, awareness is crucial because child abuse can be deadly when undetected. But by stressing the omnipresence of abuse, as well as instilling fear of strangers, these campaigns help broaden and dilute the concept of child abuse. I argue to our detriment. And those who stood to lose the most were minority families, in particular children who were removed from their homes rather than offered material support to address the root cause of much of their problems, poverty. Thus, by creating the image of the all-American child abuser as a white middle-class mother, we set the stage for policies that disproportionately impact already disadvantaged populations. Thank you very much. So I don't know what the measures of success of Foundling Hospital. I was touched like everyone else by the beautiful pictures and the letters and the stories, and I think that's great. If you take young people and you work with them and you do music and so on, there's no way that's causing harm. But the question I think is, if you look back deeper, is why were these children removed from their homes? We know that only about 13% of all child abuse allegations are actually about physical abuse. So could we have provided care for these children in their homes so that we didn't have to remove them? A lot of families are struggling with addiction. Could we have provided better like medication-assisted treatment? Could we have provided other things that would have enabled them to continue to parent? Because as the folks at Foundling Hospital said, these parents love their kids. They just lack the resources to care for them. But there's different ways to address this. Do we need to remove them and do what we think is the right thing for them, or can we help them by providing them more resources in their home? I think the second option is the way to go. But the thing is, the Foundling Hospital doesn't decide which kid gets removed and which doesn't. There's a whole set of, decision-making. There's child caseworkers, there's court decisions. Ultimately, once a child is removed from their home, I'd rather them get music and art and poetry than not. But is that the solution for poverty? Absolutely not. We should be doing better for families. We should be doing better to keep families intact. We should be doing better for America's children. Because in this country, we have one of the highest rates of child poverty. We have high rates of maternal death and mortality for women who are pregnant who are having babies. The high rates of moms who die around the childbirth. We have high rates of children who are uninsured. We have high rates of children who are hungry. We should be doing better here. So we can't be a society that only cares about children when we hear a report about how their fridge was empty or they didn't, someone left them in the car while they ran to the grocery store. We have to be caring about making sure that America's children have all their basic needs met. And that's kind of my criticism of what's going on. And someone will say quite reasonably, but Foundling Hospital is not going to solve poverty, for sure. I think whatever they're doing, if they're doing a good work with the kids, I applaud that. There were a couple things with the presentation which I disagreed with. For instance, they said, well, child abuse is not what can happen to everyone. That's true. In any race and class and any socioeconomic status, you can have child abuse. Like, a 3-year-old can have a heart attack. That's not typical. So we have data, and we know that the typical family is struggling. We know the typical family is poor. The typical dad is unemployed. We know that in 2008, when we had a huge housing crisis, the number of children who were abused and went to the emergency room skyrocketed because these things are connected. So pretending as if it's like coming out of nowhere and that anyone could accidentally be a child abuser is counterproductive. Anyone could be a child abuser. We have data about what are the risk factors for that. We can't ignore the risk factors. We should be addressing them. All right, long answer, but hopefully that. The statistics were shocking. So only about 20% of children who were removed in the 1970s ever returned to their family. So it was supposed to be a temporary solution. And this is kind of interesting in terms of what happened in American history. So foster care was supposed to be a temporary solution until families got it together. The thing is, nobody helped families to get it together. Once you removed the child, that was intervention, and then the family was struggling. So children did return to their families. They often had to jump through hoops. They had to go through all kind of classes. The classes would expire. You had to have an anger management certificate. If it's been 6 months and your court date has been moved back, you have to retake the anger management certificate. I mean, there's absolutely no data to support that taking 3 anger management classes is useful versus 2. But some children were returned. The majority were not returned. And then we had an explosion of foster care children in the 1970s, which brings us to 1980, when Congress said, oh, we have all these children in foster care. This is absolutely terrible, which was true. And their solution was, let's make it easier to adopt them out of foster care. So then we have the Child Welfare and Adoption Assistance Act, which did some important things. It was designed, and looking at the hearings, people were aware that you're using foster care too much. And they said, how can we help keep families intact on the one hand, and once they're in foster care, how can we get them a new family by adoption? Slowly, what ended up happening was it became an industry of freeing up children for adoption and having children placed with adoptive parents. And that ended up being how America addresses child poverty is we take them out of their home and then we get them a new family. There must be a better way to do that. Yes. Yeah, not everything is doom and gloom. Yes. So especially programs that have visiting nurses in their homes, that's been proven to be very effective. And a lot of cities and counties have developed this program that when you send nurses to their home to help parent. One of the amazing things that the Foundling Hospital did here in New York in the early 1970s was they had a respite care. So one of the things that drives parents bonkers, and I'm telling you this also, I have a 3-year-old and a 1-year-old, it's hard. And not having childcare is really difficult. There's a lot of moms who have no help and they're by themselves and they're struggling. The Foundling Hospital was a place where you could come and bring with your children, bring them there, you say, I'm struggling, you could drop them off for respite care or you could stay with them and get care of that. There was a model that was developed in the 1970s. Fontana had a vision, and that was really a good program. Because if we do provide childcare, we know that high quality childcare improves outcomes for children. There are different education programs for families which have been proven to be effective. Essentially, there is very little data. Even the biggest researchers in outcomes in children, they will concede that we don't have a lot of data about what works. So there are nursing visits work, improving healthcare for parents works, and then we're doing a whole bunch of things that we have no idea whether it works or not. In Pennsylvania, they have every parent who leaves the hospital with a baby watch a video from the 1980s on a grainy screen about how please don't shake your baby. That's a great idea, please don't shake your baby, but there's zero evidence that making a parent watch that before leaving the hospital makes them less prone to shaking their baby. We should have more data about what works and what doesn't. Unfortunately, we don't. But there are a few things that work. It is a catastrophe. It is an absolute catastrophe. So I'm sure some of you are following the news. The program that provides health care for indigent children has run out of money. The Congress has not renewed it. So states are gradually having to turn off eligibility for children and stop their children in the middle of chemotherapy, their children in the middle of life-saving treatment. It is a catastrophe. I don't know what's going to happen in New York because some states have some flexibility that they have money squirreled away in different places that they can move it around. Because it expired 3 months ago, but children are still getting care. I honestly don't know when New York is going to run out of money. I think New York is doing a little bit better, but I know other states have had to send letters to families to tell them that their child no longer has health insurance. It's absurd that this country is not providing health care for children. Generally speaking. And also another thing that's amazing is if you do not have health care for your child, you're a neglectful parent. Because let's say your child has a health issue and you did not bring them to the hospital because you had no eligibility, then you would be guilty of medical neglect, and you can lose your child. Or let's say you run out of insulin and you're a diabetic child, which is so expensive these days, and your diabetic child is not getting the care they need. So a very well-intentioned doctor like myself will say, well, I'm a mandated reporter. You didn't give the kid insulin. I'm going to call you in right now. So I'm going to guarantee you that what happens is not that the insulin fairy comes to their house with a bucket of insulin, but that you lose your child from medical neglect. So, I mean, it's this amazing balance where we provide so little support for families to take care of their children, and then our judgment is so harsh and our reaction is so swift in removing children, which is not, it's not effective either in terms of outcomes or in costs. I mean, we could be sending children to Harvard with the costs that we spend for them in substitute care. But yeah, it's horrific. I don't know what's actually going to happen in terms of, but I can imagine nothing good. So it used to be that the child welfare agencies would provide child welfare, you know. So they would make sure that, and they would coordinate with charities, Jewish charities, Catholic charities here in New York, and they would provide food and clothing. And I looked through the case records of children under the supervision of social welfare in Philadelphia, and the cases are amazing. So this lady had 4 kids. She had to go get a surgery done. So she said, oh, can someone come watch my kids for 2 weeks while I recover? Sure, that's why we're here, child welfare. A gentleman lost his wife. They sent a woman to help keep his house every day so that he would be able to keep, watch his children. That used to be child welfare. Okay, I'm not saying everything was perfect because kids were still being abused and things, and not everything was taken care of. But child welfare used to be services for families. And with the focus on investigation of child abuse, child welfare has become essentially an investigative agency that responds in punishing poor families. But there's very few places that families can turn. And well-intentioned people like, doctors like myself, they see a family struggling, they don't have enough food, they don't have enough money, they don't have a winter coat. I don't say, okay, you should go to Catholic Charities, pick up a coat. I say, I'm going to call Child Protective Services. Maybe they can help you. Your child needs a coat. So everything is criminalized, and it's a punishment, and there's really few places where we can seek help without being labeled as an abuser, because once you call everything neglect, and once poverty is neglect, you can't just be poor. You have to have a neglect investigation, and then you have to get services. And now that everyone is a mandated reporter, and not everyone, but we have some states in where everyone is a mandated reporter because it's universal reporting, but most states there's a very extensive definition of mandated reporting. Then you every time you worry, your daycare teacher, your kid doesn't have a lunch, you can call Child Protective Services rather than providing them with a lunch, because maybe you think, you saw the public service announcements, that that's the way to get help. Unfortunately, it's not. If it were, that'd be great. So everything, the whole system is criminalized, and there's no really open doors to walk in and get help. There are certainly charities and it's not that there's nowhere to go, but the child welfare is no longer meeting its mission of child welfare now that it's performing investigations primarily. I think there's a lack of data, and we believe too much in the goodness of the system. Doctors believe too much that calling Child Protective Services is the right thing to do. They are trained from early in medical school that if you see something, say something. If you have suspicion, you need to call. So we have check boxes we like to check off. So we see a kid that's struggling or a family that's struggling, we call Child Protective Service, and we think we've done our job. But we haven't, because that's not helpful. Of course, yes, there's a small amount of cases in which children are horrifically abused, physically abused. You need to call Child Protective Services. People should go to jail, and children should be removed. But for the vast majority, what they need is material support and psychological support. And I think people don't know that, and particularly people see that when they think about child abuse, they think about the worst cases of physical and sexual abuse, and they don't know that's about 13% of the cases, and the vast majority is not that. So I think it's something skewed in how we think about it. So and it's also an unpopular opinion to have. Nobody wants to be pro-child abuse, and nobody wants to be the person saying, hey, if you see a child abused, don't call them in. Yes, you should. If you see a child that's abused, please call them, and that's certainly not the takeaway point of my talk. But these are nuances that are difficult to parse when you're dealing with something that's as emotional as child abuse. I mean, we all hate child abuse. We all want to wipe it out and make sure it doesn't happen. But we really don't know what the way to do that is. And it's really hard to take a step back and say, is anything we're doing helping? I mean, our system is broken. We should be doing something else. So some people have said that, but that's certainly not that's not what most people are saying. Most people are saying, well, can we open a poetry group for the children too? Or how can we marginally improve on what's already existing to make it a slightly better experience? Which is also, I'm not going to diss that, but that's not going to solve our problems. And one of the reasons we're not breaking down the system is because those who are disproportionately impacted by it are people who are already marginalized and disadvantaged. If we had a system that was impacting disproportionately rich white people, you can be sure people would be all over it. But we have a system that's already, that is particularly disproportionately impacting poor families of color that are already struggling, that have addiction problems, that have make life choices that the social worker doesn't approve of. You're already having, you're having people that it's very difficult to mobilize, very difficult to write, a beautiful piece about. It's really hard to bring people to care about the fact that families, disadvantaged families, are being broken, and that's really what's going on here. And until we raise that voice and have people see what is going on, it's going to be very hard. And one of the reasons that Native Americans had the law that accepted them versus the African Americans in the 1970s was for Native Americans. It wasn't about race. It was about their culture, and it was about their sovereignty in their tribes. So it was like talking about a different country. Because I asked myself, wait, in the 1970s, why did we only care about Native Americans? Why didn't people care about African American children? Because they weren't talking about race. They were talking in terms of sovereignty, about legal questions, about who has jurisdiction of the tribes, which were things that were not applicable to African American families in urban settings. But until we get people to care, it's going to be really hard to make a change.
Thank you so much.